Naadi Yoga has had great guidance under Dr. Nishi from last 8 years. All our research and development is under her supervision, and she continues to develop therapies in order to bring psychoneurological changes in children. Epilepsy in babies. Third part. Fits, seizures, or tremors is a common disease, but sometimes it can be fatal. Let's know what epilepsy is. This is a type of neurological disorder in which abnormal waves start producing in the patient's brain. It is similar to a short circuit with a strong current running in the wrong direction between two wires. In this, the patient feels tremors. He falls to the ground, his teeth are clenched, and he becomes unconscious for some time. Seizures can occur for different reasons depending on the age of the child. Genetic. There is something wrong with the genes. The nerves of the brain are not working properly. Infection. The child may have had jaundice at the time of birth or due to some other infection. The brain has not got enough oxygen. There is a problem of brain stroke or tumor. If the child has suffered an injury in the mother's abdomen, autism can also cause epileptic seizures in children. Calcium and sodium deficiency can also cause seizures in young children. When children have epilepsy, some symptoms start appearing in them, like darkness before eyes, body stiffness, teeth grinding, foamy mouth, to fall suddenly, to faint, pupil dilation, continuous movement of arms and legs or jerk off, biting one's own tip or tongue. This disease can be divided into 3 to 4 categories. Generalized epilepsy. If the current spreads throughout the brain and the patient becomes unconscious. Partial epilepsy. In this, the current originates from one part of the body and stays in that part. Absent seizures. In this, the patient does not do any movement, sitting silently. The hand starts moving or the mouth starts moving but does not talk. Complex partial seizures. Its symptoms are also somewhat similar to those of absent seizures. Although parents are worried about the arrival of epileptic seizures in children, but its treatment is available. Now we will see how Naadi Yoga worked magically and helped these kids with issue related to fits, seizures and tremors. Now she doesn't get jerks. She is absolutely fine now. She also had fever in between, but still she did not get jerks. For the last 1.5 months, he did not get any seizures. Earlier he used to get fits very loudly. When he used to wake up, he used to get fits. Hands and feet used to be very tight. Always kept his fist closed. And used to cry very loudly. But after 15 days of taking Naadi Yoga treatment, it has not happened even once, as it used to be.
About the jerks, usually around 40 jerks he used to get in a day. Now it has been reduced to 4 to 5 jerks in a day, and some days it will be just 2 to 3 jerks. The intensity and the frequency of jerks has been reduced.
Naadi Yoga. Opposite Pacific Gulf State, Sahasradhara Road, Kulhan, Dehradun. Visit our site www.naadiyoga.com and mail your inquiries at naadiyoga@gmail.com or call on landline 135 262 9944, mobile 72520 52999.